This talk is about Glasgow Coma scale. Glasgow Coma scale scores 3 categories of responses and yields from 3 to 15 points. The categories of responses are eye-opening response. Eye-opening response yields from 1 to 4 points. Verbal response, which yield from 1 to 5 points, and motor response, which yield from 1 to 6 points. I will now explain how these points are given. During evaluating eye-opening response, 1 point is given for no eye opening to pain, 2 points for eye opening to pain, 3 points for eye opening to speech, and 4 points for spontaneous eye opening. During the evaluation of verbal response, the patient will be given 1 point for no verbal response to pain, 2 points for making incomprehensible sounds with or without stimulation, 3 points for inappropriate words with or without stimulation, 4 points for confused speech with or without stimulation, and 5 points for appropriate speech with or without stimulation. During motor evaluation, the patient is given 1 point for no response to pain, 2 points for extension of the limb being stimulated, 3 points for abnormal flexion of the limb being stimulated, 4 points for withdrawal flexion of the limb being stimulated, 5 points for localizing pain to the site of the stimulus, and 6 points for obeying oral commands such as touch your nose or move your right leg. This scale is used by most neurologists I know to follow the progression of coma in conjunction with other parameters. It should not be used to diagnose coma or to predict outcome of comatose patients. As a matter of fact, the developers of the Glasgow Coma scale stated in 1978, "We have never recommended using the Glasgow Coma scale alone, either as a means of monitoring coma or to assess the severity of brain damage or predict outcome." Yet, despite this warning, in the right clinical setting, a Glasgow Coma scale score of 7 points or less is believed to be consistent with coma by most adult neurologists. Glasgow Coma scale in children is different than the one used for adults. Thank you very much for your attention.